Anxiety and depression are being diagnosed a lot more nowadays, or at least talked about a lot more. What we need to understand is that feeling sad is not always depression, and feeling anxious or worrying about things doesn't automatically become an anxiety disorder. These are normal emotions that can be experienced by people. On the other hand, wrongful self diagnosis and minimization of an actual mental health disorder is something I'm really worried about. Therefore, let's talk a little bit about mental wellness and mental illness. What is mental health? Mental health reflects our emotional, psychological, and social well being. It is about how we think, how we feel, and how we act or behave. Mental health has a strong impact on the way we interact with people, the way we handle problems, and the way we make decisions in our day to day life. Mental wellness includes our stage of well being, our ability to cope with day to day life stresses. We can all go through different phases of poor mental health, and that doesn't necessarily make it mental illness. For example, when you lose a job or there's a death in the family, it's quite okay and quite normal to be actually grieving for your family member. And there are different stages of grief. In these stages, if you're stuck in something like depression for a longer period, then it becomes an abnormal grief reaction, and that would then be categorized under mental illness. Advice to improve mental well being would be to exercise regularly, to have a healthy sleep pattern, to eat healthy, to be into yoga and meditation. You could also access various self-help resources that would be available on media nowadays. What is mental illness? Mental illness is medically diagnosed. It is to be diagnosed by a medical professional who is an MBBS doctor and then has done a post-graduation in mental health or psychiatry. That is a psychiatrist, just like me. There is a whole textbook on mental illness, and there is a criterion that needs to be followed for diagnosing mental health conditions. Mental illnesses can cause distress and can affect a person's ability to live in normal circumstances. Mental illnesses include depression, psychosis, bipolar disorder, schizophrenia, OCD, eating disorder, and so on. Mental illnesses can be managed by professionals like psychiatrists and psychologists. You need to definitely see a psychiatrist for an assessment and a management plan to be put into place for your mental illness, and a psychologist then supports this management plan. If medication is required for the mental illness, it is a psychiatrist who would prescribe medication. A psychiatrist can also help rule out physical health conditions that could be overlapping in the first presentation of mental illness. So if you pick up any symptoms of mental illness, do not wait, do not dismiss them. Early intervention is the key here. So be sensible and go see a professional for an initial assessment and diagnosis. I hope I made some sense here and you've understood the difference between general mental health, mental wellness, and mental illness. If you're interested in knowing more about mental health issues, please subscribe to our channel and we'll bring you a lot more interesting videos. Thank you.